Hi, I'm Dr. Tony,
And I'm pharmacist Karan.
and welcome to another edition of Can
Can
We
we talk?
Talk? Karan, why are you here in my waiting room? Are you here to see one of my colleagues are trying to be romantic and take me out for lunch?
Although I love the idea of us having a romantic meal together, today I'm here for a different reason. I'm here for us to problem solve how to get patients to pick up their prescriptions.
You know, as a low carb doc, I've been, accustomed to deprescribing medication, but there are times when my patients need to be on medication. The good news is that I consider many medications as bridge therapy until they can adopt the dietary changes necessary to heal. Once they heal, thankfully, many can come off meds.
So until the healing has occurred, maybe we can talk to our subscribers about the importance of medication adherence. I'll start by reminding them that medication adherence is the extent to which a person takes their medications based on the recommendations given to them from their healthcare professional.
That's right, Karan. Even what's more surprising is that half don't take medication as directed within the first year, and 22% never get it filled in the first place. What's concerning is that meds for blood pressure, cholesterol, and diabetes have the lowest adherence rate, and medication non-adherence costs the US 100 to 300 billion per year, and one of the major reasons why they are admitted to the hospital.
Sometimes non-adherence is due to reasons like cost, the side effects of some medications, and simply stop taking meds when they feel better. I even heard patients complaining of unclear instructions, simply forgetting to take it, having trouble opening the bottles due to arthritis, or they come to me with new meds from the hospitals and old ones from the clinic, not knowing which ones to take.
Now that we understand some of the reasons why people are not taking medication, maybe we can share a few tips to reduce this. For example, make sure you understand the value of taking the medication. Taking meds must be convenient, like using pill boxes and blister packs located in the right place, integrating it into your existing routine. Make sure you have trust in the person who gave you the medication and making sure clinicians use lower cost medication.
You know what? I would even like to see reductions or eliminations of medication copays, using once daily prescriptions when possible, helping patients with cost using prescription assistance programs when needed, for patients to meet with a member of the team, either a nurse or pharmacist, to make sure that they are taking the right medications, and finally, using 90-day prescriptions when possible.
I agree, and here are my takeaways. Take meds every day at the same time and may be associated with a particular activity like dinner. If you have reasons why you can't afford your meds, notify your doctor who may have ways to make it more affordable, like a prescription assistance program. Consider writing a sticky note reminder on the fridge or mirror. Set a reminder alarm on your phone. If you've been unsuccessful with medication adherence, instead of doing the same thing over and over again, take a different path and use some of these tips so that you will have better adherence until your lifestyle changes have resulted in the reduction or elimination of medication. And remember to give yourself some grace, since it's sometimes hard to remember to take meds. We hope these tips have helped you. And if so, like, subscribe, and share this video. And until the next video, stay
Stay
safe
safe and
and healthy.
healthy.